Hi, I'm naturopathic Dr. Emily Lipinski, and today I want to chat about one of my all-time favorite herbs to address hypothyroidism. The herb is known as ashwagandha, also known as withania, and this herb has been used for centuries in different parts of the world to address hypothyroidism. It has also been used to address anxiety, depression, lower blood pressure, and help improve sleep. And I find that this herb is wonderful for many people at addressing all of those things. First and foremost, with hypothyroidism, I have seen ashwagandha time and time again improve TSH blood levels. So if you have hypothyroidism or you've explored hypothyroidism, you probably know that the gold standard to address or look at thyroid gland function is this blood test known as TSH, thyroid stimulating hormone. And that hormone is secreted by the brain to talk to the thyroid gland and to either increase or decrease the amount of hormone that's being secreted by the thyroid gland. The thyroid gland secretes T3 and T4 hormone, and when those hormones are being reduced in the blood, the thyroid gland is obviously not working optimally. So when the thyroid gland cannot produce enough T3 or T4, the TSH from the brain kicks into gear and starts telling the thyroid gland, make more hormone. So when the TSH shows up on blood work as too high, that's an indication that the thyroid gland's not working as well. The T4 and T3 hormones in the blood are too low, and therefore the TSH is increasing its level to try and improve the way the thyroid gland functions. Depending on how high the TSH level is, and if you have low T4 hormones, you're normally prescribed thyroid hormones to regulate the thyroid gland function. I've had many patients come to me over the years and say, my TSH levels are increasing. I have signs and symptoms of hypothyroidism. My MD wants me to go on medication. Is there anything natural that I can do? There's definitely a lot of natural options. First and foremost is diet. I have a book coming out in fall 2020 where I discuss all of that in detail, including ashwagandha. But to touch on ashwagandha, I have seen ashwagandha withania absolutely improve and in some cases normalize TSH levels. For some patients, that means they no longer require medication if they can maintain their normal TSH and normal T4 hormones and that their signs and symptoms of hypothyroidism have improved. So ashwagandha withania isn't for everyone. It doesn't mean that everyone that takes ashwagandha withania will no longer require medication, but it has absolutely reduced the need of medication for some patients or completely eliminated the need for medication. Ashwagandha is found in most health food stores. You want to make sure you get a good quality ashwagandha. Some of my favorite brands are MediHerb, Standard Process, Pure Encapsulations, and Restorative Formulations. The dosage of ashwagandha withania that's been associated in research with improved thyroid function is around 500 to 600 milligrams a day. Some people are going to need a little more. Some people might need a little less, especially if you're already using thyroid hormones. So it's really important to make sure you check with your healthcare provider to make sure that you're monitored by a healthcare provider. This is so important if you're on thyroid medication because, as mentioned, ashwagandha withania, especially in the dose that helps the thyroid gland function, may change the need of thyroid medication. It may help your thyroid gland start functioning better. And so you want to make sure you're having proper blood tests. When my patients go on ashwagandha, I make sure that we're monitoring every 4 to 6 weeks via blood to check in at the thyroid gland function. And sometimes we have to then change their thyroid medication dosage. So I would love to know about your experience with ashwagandha withania. Have you used it to help improve sleep? Have you used it to improve thyroid gland functioning? Have you had a beneficial experience with it? Have you had any side effects? The most common side effect from using ashwagandha is gastrointestinal upset. Some people find they have a little bit of gas or bloating or diarrhea. And also it's known in research to reduce blood pressure. So for some people that already have low blood pressure, ashwagandha takes it even lower and they may feel a little bit dizzy. So again, make sure that you're monitored by a healthcare professional, that your blood pressure is being checked on a regular basis if you're taking ashwagandha. Let me know your experience. Comment below or send me a DM.